Rose Mumford, give Shakira Mumford permission to do this video.
Okay. So hi, my name is Shakira. Today I'll be a student nurse. Today I'll be performing a head to toe assessment. Can you tell me your name and date of birth?
My name is Rose Mumford. My day of birth is September the 21st, 1935.
Okay. Do you have any history of any surgeries?
Yes.
My hand sanitizer.
Yes.
I
I had, what surgery I had back surgery, and I had, that's all I'm gonna put.
Back surgery.
Mm-hmm.
Do you take any medications?
Yes.
Do you have any allergies?
No.
Have you got the influenza shot? You know what that is?
The what?
Influenza flu shot?
Oh, no, I don't take the flu shot.
Okay. Now I'm gonna inspect your mood. Can you tell me where you are?
Yeah, I'm at home right now.
Can you tell me what's today?
Yeah, today is Tuesday.
Can you tell me the time?
The time is
You don't have to be accurate.
10 o'clock.
And can you tell me who's the president?
Yeah, Trump.
Okay, so patient is alert oriented times 4 on a pain level of 0 to 10, 0 being no pain, 10 being the highest pain. What's your pain level?
About 6.
6. Okay. Do you use any mobility aids? Well, I see a walker.
Yeah, I use a Rolay.
Do you use a gait belt?
A what?
Gait belt, you know, the belt that they put on you to stand you up?
The belt that I had, the belt that I use sometimes. Yeah, I use that.
The buckle in the front?
Yeah, no. It folds over and you pull the thing and they just stick to it.
Oh, okay. Let me see next. So I'm gonna check your radial pulse. Do that for 15 seconds. That's good. Okay, rate is regular. And let me see your hands. So I'm checking for clubbing, and I don't see any. And then I'm gonna check for cap refill. So your color blanches in less than
You stay
30
in front of
seconds.
the thing.
They can see me. So now I guess it's the head. So does it work?
Oh.
So now I would inspect and palpate the head. Skin is dry.
Now you can see that, put the thing in front.
You can see. Skin is dry. And then now I would inspect for any masses or lesions. I don't see any masses or lesions. I'm inspecting for symmetry and both sides are equal. And now I would palpate the sinuses. So, right here, that's the maxillary, frontal, and temporal. So now I would inspect the ears. So first I would check the external ear, which is the outside of the ear. Next, I would check their inner ear for blockage or discharge. hearing aids?
No,
Do you have any hearing concerns?
no.
Okay, so now I would inspect the eyes. So I'm gonna do the 6 cardinal gaze, and you just follow my pen light. Grandma, you supposed to follow my pen light. Okay, let's
Right.
go. So when I do this and go back, you just look back at it. 1, 2, 3, 4, 5, 6. Okay, good. Now I would check the external eye, I believe. So that's just the outside of the eye. I'm not gonna find you. That's good. Have you had cataracts or
Yeah, I had cataracts removed.
cataracts removed? Okay. Now I would check for pearl. So I would shine the light in each eye to see if they're round. Okay, both pupils are round. So now I would shine the light in each eye to see if they're equal. Okay, both pupils are equal. And then now I would shine my pen light in your eye to see if they constrict. And both pupils constrict. So pupils are equal, round, reactive to light accommodation. And then now when put this pen light to your nose and just, I'm supposed to expect to see if your eyes cross. So I'm gonna do this to your nose and the back. Okay, both eyes constrict. So now I would inspect the nose. So I will look in the inner nose. For mucosa, septum, and then now I would check patency. So you will hold down one nostril and breathe, and then do the opposite. And breathe. Just take a deep breath. And then do the other side. Well, basically like sniff. Okay. I'm checking for symmetry. It's equal. I'm checking for any masses or lesions. I don't see any. Now I want to inspect the mouth. Mouth is, I'm checking for symmetry is equal. Color is normal for ethnicity. So now I would inspect the inside of the mouth. So I'm looking at your gums. Do you have teeth, Grandma?
I got teeth.
And let me see your teeth. Just smile.
Eh.
Then I'm checking the buccal mucosa, which is the inner cheek. So I just gotta look on the inside of your mouth. And then your tongue, stick out your tongue. And then underneath your tongue. Okay, looks good. Gums are pink and moist. Now I will ask you to smile.
And that's on my king.
Now I ask you to smile. Puff out your cheeks. Just like a blowfish. Just puff out your cheeks. And stick out your tongue. Okay, good. So that's it for the mouth. So now I would inspect the neck. So I don't see any masses or lesions. I see moles. Symmetry is equal. Now I will inspect for JVD, which is that visible line right here. You feel that?
Mm-hmm.
And then now I will palpate the carotid pulse one side at a time. Let me do this side so they can see. good pulse. Now do the opposite side. Okay, rate is regular. So now I would inspect the chest. So first, let me see. I don't see any masses or lesions. So chest. I'm checking for breathing. It seems regular. So now I would auscultate lung sounds. So I gotta do anterior, posterior, and this lateral. So that's just front, back, and side.
Well,
So I'll auscultate breath sounds using a diaphragm or my stethoscope. And take a deep breath. 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 Okay. Now I'll auscultate lung sounds, posterior and lateral. You don't gotta move or get up. Or
okay.
anything. Take a deep breath. Take a deep breath. Breath sounds are regular. I don't hear any crackles or wheezes. So now,
That's good.
yeah, that is good. So now I'll auscultate heart sounds. So, so I hear S1 and S2. So that's just the opening and the closing of the heart valves.
Oh, okay.
And then upper extremities. I forgot to I got phlegm in my throat.
Yeah, I do that sometimes.
I forgot to assess range of motion. So put your head forward, like down, up, to the side, opposite side, and then shrug your shoulders. So now, so did the chest. Next will be abdomen. So I think I gotta lift your shirt just a little bit. So I'm inspecting for any masses or lesions. I don't see any. And I'm inspecting umbilicus.
Oh, okay.
Just right here. umbilicus. Now we'll auscultate vowel sounds, starting at the right lower quadrant. Vowel sounds are active. When was your last vowel movement?
What day? Tuesday. Last one month was. See there go. Month was Saturday.
Okay.
Saturday or Sunday.
And what are your eating habits?
I eat breakfast,
Uh-huh.
lunch, and dinner.
Okay. And do you have a status diet? Like a nutritional status diet?
No,
Like a regular diet or a low sodium diet?
No, I just eat what I want. But I don't use a lot of salt and stuff.
Okay. So lastly would be the lower extremities. And then I gotta take your respirations. I forgot to do that. So,
What you want me to do? Stand up?
no, you can sit.
Okay.
So now I'm inspecting the lower extremities. So I don't see any masses or lesions, no rashes. I don't see any edema, which is swelling. What's swelling?
A little bit. They don't do like they used to do.
Yeah. Now we'll assess range of motion in the lower extremities. So, can you lift your leg up?
Mm-hmm.
The opposite way. And then can you raise your leg up like this?
Which way you want me?
Like going up
Oh, the leg expressed out?
like this.
Oh,
So, yeah. And do the opposite side. Okay. Now we'll check the pulses, which is posterior tibial, popliteal, and dorsalis pedis.
whatever they word mean.
So, popliteal is behind the knee.
Okay.
Okay. Posterior tibial is the ankle. And dorsalis pedis is the top of the foot. All pulses is 3+, and
You
it
got
could be
this one.
anywhere from 0 to 4+. Okay,
You
so
want this one too? Okay.
so now I would inspect your toes. Do you mind if I take your shoes off?
Mm-hmm.
So now I would inspect her toes and in between her toes. That's fine. That's good. And then, okay, so I forgot to do blood pressure, respiration, and heart rate. So now I'll do your blood pressure.
I need to take you down to my doctor office when I go.
Why? Why?
You give me a good examination.
That's too tight.
Mhm.
So
No, you just touch me too.
All the way up.
Yeah. These are small ones.
Yeah, sometimes this thing is not like end all the way, because you can hear the air coming out.
Oh, yeah.
It's not going up. There we go.
Where?
That's it.
What was it?
That has nothing. We're going one more time.
Now, it can't be real low. You sometimes I get nervous when I go to the doctor or when I go. Sometimes mine is like 120, 112.
Yeah, the top number was 120, but I needed the bottom number.
Oh yeah, 120 was good too. Mine goes. You want to try the other arm?
Yeah. Inflate it.
Hmm?
Inflate it first.
Yeah, I need to take you so they can do all that you done. They supposed to when you go for a physical thing,
Yeah.
but they don't give you no physical and then check everything.
That's a soul assessment.
They don't do, doctors don't do all that no more. So I give them a good examination today.
Really? Thank you. I'm hot now. What's that?
Getting in.
What's this? I gotta let go.
Hmm?
There you go.
Hmm?
I got 120 over 70.
Yeah, that's good.
Okay, so now I would check respirations. So that's just me watching you breathe for 15 seconds. Okay, I got 16. And then now I would check heart rate. So let me see. Hungry?
Mm.
And I'll do this for 30 seconds.
Gas.
And I got 60 for heart rate. And I'm meant to assess range of motion in your hands and fingers. So do this. I'll do this. I don't know how to do this. Put your hand around my wrist and try to pull against me. Okay. And then fingers. And try to pull against me. Okay, that's good. And that's it. That's my head to toe assessment. I believe I did everything. Let me check. Yep. I did everything.
Yeah, I need. You're welcome. Yeah, I need to take you with me too.